Today we'll be discussing our return to campus in the fall. A second town hall will take place later this afternoon for undergraduate and graduate students and families. The university sent several messages communicating the plans to return. However, we know you have many questions. We've already received nearly 2,000 questions for the town halls, and we'll do our best to respond to as many questions as we can today or after this session. To answer your questions today, we have with us University President Dr. Eric Barron, who you will see is alone in our studio so that we can be with you today without our masks on. Joining by Zoom, Executive Vice President and Provost Nick Jones, Vice President for Student Affairs and Co-Chair of the Return to Campus and Community Task Force, Damon Sims, Vice President for Human Resources and Co-Chair of the Return to Work Task Force, Lorraine Goffe, and Associate Professor of Biology and Researcher with the Center for Infectious Disease Dynamics at Penn State, and the co-chair of the Public Health and Science Assessment Task Force, Matthew Ferrari. First, President Dr. Barron would like to say a few words.
Thank you. Before we start with the purpose of today's town hall, I'd like to take a moment to address other issues that I know are on your mind as we are experiencing a real national crisis beyond COVID-19. I share with you the deep concern about the racially hostile remarks and anti-Semitic actions that were shared on social media. As I hope you saw from my last message, I am, and the university leadership is, committed to making changes at Penn State. Please join me on June 29th at 3 p.m. for a town hall that will be dedicated to discussing the steps we are already starting to take. I welcome your ideas and participation as we move forward. Well, thank you and welcome back. I want to say thank you. We know these last few months have not been easy, personally or professionally, and you rose to the occasion, transitioning to remote teaching this spring, and I'm proud of your extraordinary efforts to continue to deliver world-class learning experiences and educational outcomes. This has been an exceptionally difficult time, and the university has and will continue to work towards keeping employees supported during this difficult time. I'm grateful for your commitment to meeting the individual needs of our students, cultivating community from afar, and going above and beyond to support one another during a challenging time. We've heard from thousands of students, faculty, staff, our community members, and our peer institutions, and have critically evaluated all the feedback. Our decisions were not taken lightly within a difficult environment, and we are committed. As you know, after months of analysis, research, and extensive planning, Penn State officials have determined that the university can meet or exceed the Pennsylvania Department of Education's guidelines for universities and will resume on-campus learning on August 24th, with all in-person classes converted to remote delivery after November 20th. It's important to stress that while we are all enthusiastic about our collective return to campus, how the pandemic continues to unfold across our Commonwealth will be greatly impacted by the actions of each and every member of the community in adhering to public health guidelines, which include wearing face masks and adhering to social distancing practices. Let me be clear, students, employees, and visitors are required to wear face masks in classrooms, labs, and offices, and we will hold individuals accountable. Our expectations, of course, are also that individuals will wear masks on campus and in the community, as well as follow other guidelines for distancing and hand washing, for example. If masks are not an option for some individuals, we are looking into alternatives. 16 task groups, composed of more than 250 people, developed Penn State's back-to-state plans, with faculty experts playing a leadership role, co-chairing the Public Health and Science Assessment Work Group. The decision is extremely complex, and the teams critically reviewed the survey results and other feedback from students and employees. We will continue to make changes and work with our faculty and staff and students and evolve our plans as needed over the summer and through the fall. We know there are a lot of other questions and concerns on your mind that we will talk about today, including faculty concerns for their own personal health and well-being while teaching face-to-face. I want to be clear that the health of each and every one of you and your families is our top priority, and we hear your concerns. Each class and situation is unique, and we have an expectation to deliver a high-quality education and are committed to working closely with Faculty Senate on how to effectively proceed with individual courses. I know many of you are waiting to hear about the status of furloughs that I announced in April for employees who could not work remotely and did not have work on campus. You will recall that we were able to provide 50% of salary and benefits through June 30. Our employees were also eligible for stimulus and unemployment support. I'm pleased that with our back-to-state plans, we will be able to return most of those workers to their positions in August. We will continue the 50% salary and benefit support through July 31 to get us to August and a return to work for those employees. In order to provide isolation space for students who may test positive for COVID-19 or have been exposed to someone who has, we will need to repurpose the Nittany Lion Inn to be used for single-room isolation space through at least the fall semester. Unfortunately, this closure of the inn as a hotel will result in layoffs for about 79 employees. The university will be looking for alternative work for displaced employees. The financial and other impacts of this pandemic are forcing us to make many hard decisions, and this is one of the most difficult because of how it affects our dedicated employees. Extremely challenging financial conditions and the need for isolation space ultimately compelled us to make this difficult decision. We've notified employees of the inn. I know this is difficult news. Given Pennsylvania's county-by-county approach to managing the pandemic, the status of each Penn State campus may vary slightly as we recognize there are differences in location, residential and commuter, and you will hear from your chancellors on specific plans. If the country, the Commonwealth, or a county home to one of our campuses were to see a serious resurgence of COVID-19, and we would need to alter the learning format, Penn State has the ability to transition rapidly as our entire model is built on flexibility. I want to thank you again for your dedication and efforts, and we look forward to continuing to work closely together with a number of faculty and our experts across the Commonwealth campuses. Much work is needed as we evolve and finalize plans together over the summer.
Thank you, Dr. Barron. Provost Jones, would you like to say a few words as well?
Yes, thank you, Ben. I would also like to thank all our faculty and staff for their tireless efforts and commitment. Moving 18,000 courses and 97,000 students to remote delivery this past spring was truly an extraordinary achievement. Delivery of curriculum this fall will occur through a highly flexible mix of in-person, remote, and online instruction throughout the semester. Your input will be vital moving forward. University leadership and the task groups will work with governance and advisory bodies, including the University Faculty Senate and the University Staff Advisory Council, to work through all the details of course delivery, classroom and workplace safety, and other components associated with the return to campus. Penn State will start to have students and employees return to campuses in phases, beginning this summer. More information will be shared with individual units and employees. We are also excited to welcome back and committed to working with our graduate students and international students. And we will discuss this further during our next town hall at 3:30 p.m., focusing on undergraduate and graduate students and their families. On-campus research activities have resumed using a phased approach. As part of the return to on-campus research, Unit-specific processes and protocols have been developed to prioritize the health and well-being of researchers, faculty, staff, students, and the community. The return to on-campus research will be gradual and will look a bit different for each college, campus, institute, or unit. Individual questions by investigators should be addressed with their dean, chancellor, or institute director. Laura Weiss, our Senior Vice President for Research, has issued detailed guidelines available on their website. It will take all of us working together to be successful in this effort. Thank you.
Thank you both for that introduction. We're going to move on to our questions now, and Dr. Barron, we'll begin with you. And if you could give us a look at what the university is doing to make all the campuses as safe as possible.
So it's an extraordinarily broad set of activities, from purchasing large-scale masks for employees, students, and our campus visitors, to having hand sanitizing stations at the entrance of buildings and classrooms, to policies on required masking and social distancing, to educational activities, to limiting the size of classrooms, to designing classrooms that allow social distancing, to ensuring that we have a very flexible, as Provost Jones said, mechanisms for delivery and flexibility to change. It really is an extraordinarily broad set of efforts.
Thank you, Dr. Barron. And you mentioned in your opening statements that we've had several task groups reviewing all of those angles and putting action plans in. Matt Ferrari, one of those task groups, was there anything you'd like to add about safety procedures for the campuses?
Sure, yeah. So the main pillars of our approach are prevention, which are the things that we're going to see every day. That's masks and sanitation, and testing, right? We're going to test symptomatic cases and hopefully have broad capacity for testing asymptomatic individuals to monitor the health of our campuses and communities and see whether or not we're seeing changes in the epidemiology of this disease. Those are the everyday things. But we're also putting in systems that are going to allow us to respond if we do see an increase in cases. And those are procedures and facilities for isolation, contact tracing, and quarantine. And that's what's going to allow us to have that nimble response that will handle the day-to-day if everything is going well, and give us the capacity to respond if we do start to see outbreaks.
Thank you. Dr. Barron, you mentioned this in your opening statements again regarding mask wearing, social distancing, and the enforcement of that, but it was one of the most popular questions we received. So if you wanted to expand on that, how is the university going to enforce that mask wearing?
So first of all, I just want to say that there's starting to be growing evidence just how important masking and social distancing is to control any spread. We're seeing lots and lots of studies coming forth because of different activities around the country, and it's clear that it works. And so this then turns us to the notion of the requirement, which I believe is essential in the classrooms and in our laboratories and our university spaces, that people follow those guidelines. They make a difference. And so we have the opportunity, I think, to be forceful with our employees, but we also have, through the student conduct process, the ability to tell a student that they do not belong in a classroom if they do not wear a mask and if they do not social distance.
Damon, if I could follow up with you for a moment. What support will professors have if students aren't adhering to those guidelines?
Well, Ben, just picking up on what President Barron was saying, one piece of good news in all this is really that we're not having to create out of whole cloth a whole set of new policies and practices in everything we do in response to the pandemic. Faculty members have long had considerable influence over behavior in the classroom, either through informal means, such as conversations with students, just to remind them of what the expectation is about masking, for instance, this fall in our classrooms, and to encourage students then to comply with those expectations. But they also have grading policies. Some faculty members have participation grades that go along with the rest of their grading. They should utilize those grading opportunities to influence student behaviors. And then, as Eric was saying, where students fail to comply, despite those efforts, faculty members can refer students to our conduct process, the Office of Student Conduct, where students will be required to participate in a disciplinary process before they can return to the classroom. And we've long had a clause in our Code of Student Conduct that essentially says if you fail to comply with reasonable university expectations, you're in violation of the code. So this would be a reasonable directive that students would be expected to honor. But we also hope that students are going to want to honor it, and their peers will encourage them to honor those expectations in the classroom. And that we also are able, with some of those masks that President Barron mentioned that we purchased, to have them available to students who may forget their mask for whatever reason. They can simply be given a mask. So we have a number of tools to use in ensuring that the compliance to these expectations in the classroom occurs.
So it sounds like you're all saying the university will be supporting professors in enforcing these guidelines.
Absolutely.
Thank you. And Lorraine, if I could bring you in for just a follow-up, because there will need to be some mask-wearing exceptions. People with trouble breathing, people who depend on lip reading and facial expressions, perhaps the teaching of language. Lorraine, can you talk a little bit about that?
Yes, absolutely. We actually already have processes in place to address issues that might require accommodation through our affirmative action office. And so if individuals have trouble breathing or other health conditions that limit their ability to wear a mask, they would request an accommodation and be managed through the affirmative action process that's already in place.
Thank you. Provost Jones, if I could ask you a follow-up on that as well. With regard to masks, I believe it was said that the university will be supplying those along with hand sanitizer and other PPE?
Yes, that's correct, Ben. We in fact have already purchased about 500,000 masks that are available for distribution. We've also ordered several thousand additional hand sanitizer stations, working on increasing signage, reconfiguring furniture, and limiting the occupancy of particular rooms. These measures are all part of a layered approach attempting to really enhance the safety of our faculty and staff.
Thank you. And if I can stick with you for just a moment, what options is the university looking at to find the right kind of mask? Obviously, many options out there.
Yeah, that's a great question, Ben. So we have had some of our colleagues in the College of Medicine and Penn State Health doing some preliminary assessment of different mask types for different applications. And just this week, we stood up an additional task group focused specifically on evaluating PPE for classroom use. That group is co-led by Jim Crandall from Environmental Health and Safety and Keith Manning, a professor in the Department of Biomedical Engineering. And they've been given a couple of weeks to review all of the many options that are available and make some specific recommendations as to what is best in the classroom environment. We want to make sure that we're providing equipment that will keep everyone as safe as possible and to help you do your job successfully while you work with our students to provide a high quality learning environment.
Thank you. Provost Jones, we'll stick with you for just a little bit longer. And we have had many people. One of the other most common questions we received were surrounding the 250 students in a classroom limit, and that being the trigger to switch to remote or online. If a professor is teaching a class that is smaller than 250, but is concerned for their health, can they decide to hold the class online or remotely on their own? And what if that professor is or lives with someone who is immunocompromised?
So at this time, Ben, we've asked faculty in all of our units to carefully consider their teaching plans for the fall and to discuss them with their unit heads or division directors. Of course, anyone who is immunocompromised or lives with someone who is or has some other type of special circumstances will not be expected to be in the classroom. We completely understand that concern. Our expectation is that faculty able to teach will be doing their best to return to the classroom environment. Our students need the faculty to be present to deliver a robust education and an outstanding educational experience. However, we understand that there are many unresolved questions at this time. As President Barron indicated, we're working very hard to create as safe an environment as possible. There will be expectations for everyone in a classroom, as you've heard, to follow safety procedures, including mask wearing, and a process in place to support faculty to end a class in the event that someone doesn't follow safety procedures by, for example, refusing to wear a mask. We are working through testing strategies, designing safe spaces, enforcement with respect to student behaviors, and we will be working closely with academic leadership and our faculty to finalize all of these plans with their input included. All of these things working together will produce the best results.
Sort of a layered approach. No one single solution can do this, but many on top of another.
That's correct.
Thank you. Lorraine, if we could switch to you. We've had a lot of similar questions from staff members, people who are asking if they can stay home if they have health concerns. Can you address?
Absolutely, yes. We understand there's a great deal of concern from our staff members about returning to the workplace if they have health concerns. So I want to assure everyone that we are doing all we can to create a safe environment as possible. It's top of mind to us. As the president said earlier, and also the provost, we are planning a phased return to the workplace, and that is happening as we speak. We are looking at all sorts of factors in terms of who really needs to be in the workplace right away, direct contact with students, and if that contact needs to be face-to-face as part of the consideration. And yes, also about health concerns of the individual and their family members. And so as each unit begins to work on their return to work planning process, they will consider all of these factors. And so I'd encourage any employee to discuss their circumstances with their supervisor, who will consider that along with the overall unit needs as they plan the return to the workplace for individuals in their unit.
Thank you very much. Matt, we're going to send the next question to you. And many people have asked, as we are returning to our classrooms, exactly how are they being modified to take into account social distancing and that 6-foot rule?
Yeah, so the 6-foot rule, I want to clarify, right? It has two really primary rules. First, the primary motivation for this is to prevent transmission and reduce the risk of transmission. The second goal is actually just to minimize the burden on the contact tracing system by limiting the number of close contacts overall that are generated through the educational experience. So this is actually part of that layered approach that's both trying to achieve a reduction in risk overall, but make our response systems more effective if they have to be called upon. And so what we've been doing is we've been reviewing Penn State's more than 1,700 classrooms across all of our campuses, moving desks and blocking off seats to allow for social distancing. So this is not something that will be burdensome on either students or the faculty. And then also creating things like distance markers and directional arrows and increased signage to encourage everybody to follow these rules, to keep everybody abreast of what the behaviors should be, and make sure that this is something that just becomes part of our general behavior, so it's easy to achieve, and we can all have that, we can all take advantage of that reduction in risk.
Thank you. Dr. Barron, we're going to go back to you. What are university medical staff across the Commonwealth campuses doing to prepare for that testing or an influx of patients?
So to tell you the truth, I'm really quite impressed by the level of effort and how thoughtful both the group that's working on testing and tracing and public health, all of the work that they are doing. And the key here is meet and then exceed the recommendations that are provided for by the state of Pennsylvania. So this goes from a testing capability for those who are symptomatic, to be able to do the tracing and testing of those who have come in contact, and to move forward with testing of individuals that are asymptomatic. And I believe that through partnerships with private entities, through capacity changes at Penn State, that we really have a lot of promising development for us to be able to do this in a comprehensive, deliberate, thoughtful way that helps mitigate the spread and ensure the safety of our employees.
Thank you, sir. Sticking with you for just a moment longer, and you mentioned testing. And what will the university be doing to test students, faculty, and staff for the coronavirus?
Well, so I think it's far better for Matt to be describing all the things we're doing and the strategies, because this again is kind of a thoughtful, layered set of strategies for the university to move forward. So the scope, as I said, is to go beyond the requirements from the state of Pennsylvania, which are to test symptomatic individuals and to protect those who are at risk. We have growing capacity to go much farther than that.
Matt, could you add something to that?
Sure. And so really, as Dr. Barron said, this is going to be a multi-pronged strategy. So first, prioritizing rapid testing for symptomatic cases, and then the testing of contacts to try and identify pre-symptomatic or asymptomatic individuals so we can get them into isolation and reduce the possibility of transmission. And then testing asymptomatic individuals, both to estimate the prevalence on our campuses and to detect outbreaks. The priority of each of these components on the system is going to change over time as the epidemiological conditions develop. And we have, if we have very few cases on campus, we might shift some of that focus to trying to look for asymptomatic individuals and providing the reassurance that indeed things are going as well as we hope. And if there are cases on campus, then we might again shift that testing more towards contact tracing and more expanded testing of contacts and contacts of contacts, because that will be the most efficient way to identify cases and reduce transmission. So again, it's a flexible approach where we'll be shifting the weight of the process onto each of those different strategies so that we can address the needs that we have that are changing over time and in fact are likely to be different on all of our various campuses.
Thank you. Dr. Barron, if we could stick with that contact tracing, if people have privacy concerns, will they be allowed to opt out of that procedure? And how do you balance the public health need with those privacy concerns?
So I think it is extremely difficult for anyone to insist that you must tell us the individuals that you've come in contact with, although we certainly can encourage. But one of the other things that we're seeing is that peer pressure plays a role here. And also we're seeing that through surveys and other pilots in other parts of the country, that people are motivated by keeping other people safe. And that's really what the objective here is to make sure that if someone tests positive, that they take responsibility for helping keep other people safe. And so I think in that sense, people will be responsive and make sure that we can track down the individuals and ensure their health safety.
It sounds like a lot of personal responsibility and working together will help us get to that desired outcome of staying on campus.
Correct.
And what type of occurrence would prompt an earlier change in residential learning?
So there are a lot of factors here to think about. And again, I've been very impressed by our groups that are working on these topics. So you're really looking at a lot of different factors. There are some that are quite direct. The governor may decide, based on case loading, that the color coding for a particular county has to change. There's all sorts of other factors that are associated, a set of metrics, trigger metrics, that are based on the community health, that are based on what is the potential to overwhelm the local health providers, or the ability for us to help quarantine and to isolate. But again, it's not just a single factor that acts in this decision, but multiple factors.
Thank you. Matt, if we could go to you, how is the university going to inform the community of COVID cases?
Yeah, so we're really committed to transparency in this process, largely because we want everyone on our campuses and across the community to be well informed about what's happening in the campuses and what's happening in the communities surrounding them. An informed community is going to play a really important role. If everybody knows what the risks are, then we can encourage people to increase their distancing or redouble their efforts at wearing masks and generate increased support for contact tracing and other efforts to combat that spread. So it's really this transparency is really a critical part of this. So the university is going to report any cases that are detected on our campus or in our staff and employee population to the health department as required. But then also the Department of Health is going to be recording cases among students at their campus address rather than at their permanent address. So both the Penn State and the Department of Health reports should be consistent in reporting cases in the vicinity of our campuses.
Thank you. Provost Jones, we have many Commonwealth campuses scattered throughout Pennsylvania, and some of them are in very different areas. I'm thinking of highly populated areas like near Pittsburgh and Philadelphia. What special considerations are being made for campuses with different needs?
That's an important consideration, Ben, and I appreciate that question. As you noted, every one of our campuses, well, first and foremost, they're all Penn State, but they're all different and unique in their own ways. And our response to this must provide campuses with that common support that we see across all locations, but also be tailored to the unique needs of particular locations. For example, at a very basic level, some of our campuses are very residentially oriented, and others are almost wholly commuter campuses. And so clearly the way we approach each will be different. The university guidelines that we're developing will help leaders at each campus implement the policies that will best protect and serve their individual communities, aligned, of course, with the governor's plan for Pennsylvania.
Thank you. Lorraine, we have a couple of questions for you. Because classes are going to be held on Labor Day, that was announced earlier, are all employees going to be required to work on Labor Day, or is it just the faculty who are teaching? And for those who would not normally work on Labor Day, would they get a compensatory holiday?
Yes, another great question. So the decision to work is going to be dependent on unit needs. So each unit will have to decide who needs to work on Labor Day. But our guidance to unit leadership really is that only those employees who really need to work should be asked to work, and to allow as many employees as possible to have the day off, to take it as a holiday. That being said, for those employees that really do need to work on Labor Day, they'll be compensated based on university policy and the appropriate collective bargaining agreement. We already have policies in place to address people who have to work on Labor Day or any other holiday.
There was another couple of changes mentioned at that same time. So what are the expectations for employees over the week of Thanksgiving with students departing campus on Friday, November 20th? Will that operate like in previous years with respect to holidays, time off, campus closure?
It will operate as it always has. There'll be no changes to university policies regarding holidays. And the university will continue to observe those holidays outlined in the policies and the current collective bargaining agreements. So no changes on that front.
Okay, I have one more for you, and then we'll give you a break. When classes transition to remote delivery on November 30th, will all employees also shift to remote work, or will those who have returned to campus remain on campus to work?
So that is also a unit-based decision. Each unit leader will determine who needs to be on site based on work responsibilities, the location, and the needs of that specific unit. And so I would encourage employees to talk to their direct supervisor to determine what their role will be come November 30th in terms of being on site or being remote.
Thank you. Provost Jones, we have a question to you, and this is a sort of a big picture question, but how is the university handling the return to research? Very important research we do here.
Well, as you can imagine, a lot of our faculty were just chomping at the bit to get back to their laboratories or to their offices where they had needed materials for their research. We took a very deliberate phased approach to bring those faculty members back to be able to perform their research in those facilities. Each unit had to submit a comprehensive plan that was reviewed and approved and indicated that all appropriate safety approaches were being put in place. We've had good progress so far, and actually, as we've been doing this over the summer, we've been learning a great deal that we hope to put into practice as we move into the fall and start bringing our students back. I will add that research that can be done remotely should still be done remotely, and that research that really does need to be done in person, and there's much of that across the university, should be done first and foremost with the health and well-being of the faculty member and all of the researchers in his or her lab top of mind.
Thank you, sir. Lorraine, we have another very popular question for you now, and that's when will Penn State childcare services resume? And what if childcare isn't available for some people, or those people are reluctant to send their children back to daycares?
Yeah, another very important question, and one that we've heard quite a lot. And we understand how important safe childcare is to all parents and members of our community. So at this point, we are planning to reopen our childcare centers consistent with all state and public health guidelines. And we will have more information about the timing on that in the coming weeks. But I will say that we know there are a great deal of uncertainties. There are differences, geographical differences that we're concerned about. We know there are still some uncertainties in individual employee circumstances, whether or not schools will be open, all sorts of concerns. So we are asking unit leadership to be as flexible as possible as employees address their individual circumstances, frankly, all of their circumstances, including concerns about not having adequate childcare when individuals have to return to the workplace.
Thank you. Dr. Barron, we have a question for you. And what is the university doing about fall athletics? It's a very complicated topic and one a lot of people are thinking about, particularly with football and the dangers those large crowds represent.
Well, thank you for that question. I know that's on the minds of a lot of people in our communities and on our campus. So first of all, we have athletes that are beginning to return. And that is not a message on what to expect in the fall. That's a message on our concern that should we be able to return to the field of play, that our athletes are physically fit, have had the appropriate nutrition, and we're not putting them at risk because of a last-minute decision. The topic of the sports activities for the fall is an active one nationally. It's an active one in the university. It's very active in the Big Ten. I have heard so far of no university that intends to have a full stadium coming into the fall, but rather most are planning for a highly restricted attendance. The Big Ten is thinking very carefully about sharing of information and having like rules so that we can make sure that our athletes are safe should they be playing another team. We'll see more about this in the future as Big Ten presidents, for example, continue to meet to discuss exactly what our plans are for safe return to athletics. But I will tell you, none of us have any intention of having a massive number of individuals that then provide the opportunity to spread COVID to different communities.
Thank you, sir. And we'll stick with you for just a little bit longer. When does the university expect to resume normal hiring practices? This has been a question on many people's minds. They feel they have an opening that they need to get filled.
So we have labeled this as not a hiring freeze, but sort of a hiring chill, I suppose, as we work hard to be very thoughtful in the face of considerable budget constraints. We have far less in accessible reserves than we've had in the past. We have robust paid accepts of incoming students that looks very promising. We're thankful that we have flat support from the state so that our revenue picture begins to look more solid. But this is a tuition-driven institution, and our budgets and our ability to do things is highly dependent on having students that are enrolled in our classes and working towards a degree. So part of the notion of a care, not a freeze, is that of course we have essential things that we must do and we must pay attention to, but the key here is to see what the fall semester is like in terms of enrollment, a much better picture of what the budget of the university is. There are many scenarios that we have developed there. There are, across the spectrum of the university, already significant revenue changes, and we expect there to be significant revenue changes in the fall. So this is a matter of being deliberately very careful, identifying the funds that we can use to make sure that we weather this tremendous financial impact and continue to support our employees and provide that world-class education. But what that means is until we see exactly that revenue picture, it's very hard to conceive of a completely normal hiring process.
Thank you, sir. Provost Jones, we have a follow-up question for you as well. Similar to when we can resume hiring, many people are asking that when domestic travel for work could be back into the picture.
Since March, we have been restricting university-related travel, as everybody is aware. We have been making exceptions, but whether it was for domestic travel or international travel, all of those exceptions had to be approved by my office. For a couple of months, there was a fairly low volume of requests, but as counties and states began to open up more, that volume has increased. So we are keeping in place the requirement until June 30th that all international and domestic travel needs to be approved by my office or with Kevin Black for the College of Medicine or with Laura Weiss for ARL. But from July 1 only, we are shifting that responsibility for review and approval of travel requests to unit executives. So this will now go to the hands of the deans, the chancellors, and so on to make those decisions locally, reflecting the needs of faculty and staff in those particular units. I know, Ben, you asked me about domestic travel, but while I'm at it, I'll just mention international travel. We are keeping the restriction on international travel in place for the foreseeable future. We may relax that a little bit in the future, but at this point, all international travel still needs to be exceptions still need to be submitted to my office for review and approval, and we expect that continuing for a bit longer yet.
Thank you for that answer and for thinking ahead a little bit. Damon, we have a travel question for you now. And is there going to be travel guidance for students? Obviously, we know that fall semester abroad has been canceled. Can we expect a determination for spring study abroad?
Well, I think watchwords in all that we're doing, Ben, are nimbleness and flexibility. So we have to wait and see what the virus will allow. At the same time, it's fair to say that we want very much for our student experience, both in the classroom and beyond the classroom, to be as complete and robust as it possibly can be. So where there are opportunities in the spring, if the virus makes it possible, we will certainly move in the direction of opening up the complete complement of opportunity for international study abroad programs that students have expected in the past. But it's really too hard to predict. All these things are very fluid and they change day to day. It's impossible to know what the situation will be 6 or 7 months out. But that's certainly our ambition to make those opportunities available to students.
Thank you, sir. Provost Jones, we'll come back to you. We talked about our people traveling elsewhere, but many professors, as part of their classroom, bring a speaker in. And will there be guidance on bringing in guest speakers?
This is something that we are keeping a pretty close eye on. And so we are trying to treat this in a manner consistent with how we treat the travel restrictions. Of course, I think many of us are concerned about the risks to the institution of bringing in people to our communities who come from areas where the situation with COVID-19 may not be as good as it is at our location. So we are discouraging the scale of visiting speakers or faculty that we would have in a normal academic year. Of course, as with everything, if the unit leader feels like an exception needs to be granted in a particular case for a particular circumstance, we will certainly consider that request. They just need to contact my office. We'll review on a case-by-case basis.
Thank you. Lorraine, we have a question for you now. And how is the university handling the cleaning and disinfecting of really highly trafficked areas on the various campuses? And will faculty members or even students be asked to sanitize their area after use?
Yeah, thank you for that question. There will be extensive cleaning and disinfecting of all high traffic surfaces in classrooms, labs, offices, in restrooms, those public areas. And there's guidance on the Environmental Health and Safety website about cleaning and disinfecting of areas. But in addition to that, the return to work implementation teams, the unit-based teams, will develop cleaning protocols and schedules to disinfect high-touch areas in their own areas, their own offices and workspaces. But I will say to you that earlier there was a comment about personal responsibility. And I'd say this is also an area where personal responsibility or shared responsibility is really critical, that we should try to avoid sharing equipment where possible, but where that's not possible, we ask the individuals also help in making sure they maintain those spaces. So things like copy machines and microwave ovens that are just used by others in the unit, cleaning spaces after it's been used would also be helpful. But certainly the university will take care of those public areas and areas that have a high touch, high surface areas.
Thank you. Nick Jones, we have another question for you. And this is one a lot of faculty members have expressed concern. There's a lot going on right now. A lot more is being asked of people. And how is the university going to support those faculty members as they teach their courses, both potentially in person and remotely within the same semester?
Thanks, Ben. Yes, given the circumstances, we all need to be very flexible in how we work, including managing in-person, online, and remote teaching environments. We know we're asking a lot of our people, and we are here as an institution to support you. Things that we're doing on a number of fronts, we're adding technology to classrooms. For some classrooms that were minimally equipped in the past, we're making sure that they have the equipment they need to facilitate remote or hybrid instruction as necessary. We have technology training and assistance. What we observed back in the spring was that many faculty had, some of whom had never even used Zoom, had to very quickly become Zoom experts, and they didn't necessarily have the tools and the equipment they needed in order to do that effectively. So we made equipment available, iPads, laptops, so on, and we're continuing to do that. I just approved a couple of weeks ago the acquisition of a number, several hundred more iPads that will be available to support faculty in the classrooms, and training and assistance on how to use all those tools, as I mentioned, is really important. We have a new website set up that complements the remoteteaching.psu.edu. It is called keepteaching.psu.edu, and obviously has a slightly different focus for the fall semester from what it did back in the spring. This site will be a repository for useful information that we hope will provide resources to faculty to help them navigate through the fall semester. There's, of course, the Employee Assistance Program for help with any personal, family, or work-related issues. And I would just reiterate that we are here to support you in the important mission of educating our students. This is difficult. I don't want to overuse the already overused word of unprecedented, but it's unprecedented. And we, the university, have expectations of you, and you can certainly have expectations of us. And we're going to step up and support you and make you feel safe in your teaching environments in any way that we possibly can.
Thank you very much. And we'll make sure that we include links to that Keep Teaching website and follow-up communication. And as I said at the beginning of this event, we had nearly 3,000 questions submitted for our town halls, and we tried to answer as many of them as we could. But I want to tell you, this is just one type of communication. We are going to be posting much more information, more answers, more solutions in the coming days and weeks on Penn State News and at the psu.edu virus info site, which has been expanded, and we are continuing to update that source. It is the greatest repository of all information. We do have another town hall coming up. So Dr. Barron, is there anything you would like to say in closing?
Yeah, thank you, Ben, and thank you all for listening. We truly appreciate it. I want to thank you again for continued dedication and tireless efforts to support our community. We look forward to working with our faculty and staff and students as we evolve our plans over the summer. Your health will continue to be our highest priority as we move forward. The Penn State experience may look somewhat different this fall, but I'm very much looking forward to seeing our campuses busy with students, faculty, and staff again. And as mentioned, please do not forget to join me on June 29th at 3 p.m. for a town hall that will be dedicated to discussing the steps we are already starting to take in new efforts to address racism and bias. I really want to add just one more element, and that is that I'm really gaining confidence in how thoughtful the university has been and the teams in developing the advice and plans to move forward. It's not something that you can just reveal all at once. It comes in phases as we watch things evolve. But I have to say, personally, although people view my age as somewhat being at risk, that as I watch the policy on masking, social distancing, as I look at the plans, thoughtful plans for testing and tracing to evolve, that I'm personally looking forward to meeting my class in the fall face-to-face, because I have growing confidence that this is a university that is being very thoughtful about your health and safety. Thank you for listening.
Thank you, sir. I do want to thank Dr. Eric Barron, Nick Jones, Damon Sims, Lorraine Goffe, and Matt Ferrari for answering questions today. As I said before, there's going to be another town hall this afternoon at 3:30 p.m., and we're going to focus on graduate and undergraduate students and their families. We're going to be taking questions from those students themselves, concerned parents, loved ones, and I want to thank you all for the remarkable job that you've done during, sorry, Nick Jones, but it is unprecedented. This is an unprecedented challenge facing us all, and I look forward to returning on campus with you in the fall. Please keep an eye out for follow-up stories, and which will include the archive video from today's sessions in case you joined us late or missed any part of it. Please bookmark and continue to visit psu.edu/virusinfo for the latest updates and information. And there is a link on this website, liveevents.psu.edu. Thank you all and have a good day.